After last year's complete lockdown experience during Eid al-Adha due to COVID-19, this time people are excited to celebrate in a more relaxed atmosphere as everything is open just like it used to be before the pandemic, thanks to the concerned authority for tackling all challenges and managed to reach many achievements and gains. And thank you goes also to the public for their commitment to all decisions that led in achieving successful result in bringing down the number of COVID-19. However, COVID-19 is still around the country and around the world. Therefore, it is important to be aware and take necessary measures. With me here is Dr. Saif bin Salim Al-Abri, the Director General for Disease Surveillance and Control at the Ministry of Health. Dr. Saif, welcome to our studio and thank you for your time.
Thank you very much, Abdallah, for the opportunity.
People have missed the real feel of the festival last Eid al-Adha. At this time, they are ready with all Eid activities. What message would you like to convey to all of them?
We are all aware that COVID is still around, and globally, there's an increase in the cases of COVID-19 in the last 4 weeks. Luckily, the mortality or the numbers of death are coming down, but in general, some of the regions, the numbers are increasing. For example, the East Mediterranean region, where Oman is part of it, has seen an increase of around 29% of the cases in the last 4 weeks. But there are some regions that are recording reduction in the numbers of cases as well. For example, the African region and the Americas.
In this case, Dr. Saif, what is the situation in the Sultanate?
In Oman, we are having a stable situation, although we started to see an increase in the numbers in general. And also we started to see some increase in the numbers of admissions to hospitals. But the situation is good enough that we are going to have Eid, and it's the right of people to celebrate as well, but we need to celebrate in a nice way and in a wise way.
Again, what advice would you like to give for people to celebrate in a right way?
My advice really was for people to avoid big gatherings, especially indoors, and also to protect themselves by using hand hygiene, washing the hands by water and soap, or using sanitizers. And also for people who are having acute respiratory symptoms, for example, fever, high-grade temperature, or having flu-like symptoms, not to mix with other people and not to go for Eid prayers and not to go, in fact, for gatherings. I would advise them to stay home, wear masks, and also for us, the public, in case we meet others or we mix with others who are having respiratory symptoms, we better avoid them. In addition, also, we should protect our loved ones, especially the elderly and people who are having chronic diseases, and those who are having low immunity, and young kids, because these people are really at high risk of getting the disease, even if they are vaccinated.
People tend to ask why they must keep up protective measures even after getting vaccinated.
The immunity of the vaccine may wean off, which means that the protection may come down with time. That's why many countries, they advise for extra dose of the vaccination if someone has completed 9 months from the 6 to 9 months from the last dose. And this is the same advice which we give to people, like especially people who are at high risk. We know that the vaccine prevents from severe disease and from fatality, like from death. People who are vaccinated, really, they are much less admitted. Now, most of the countries look at COVID-19 as it's part of the routine diseases, that it's there and we need to live with it. And the thing is that a lot of the preventive measures that we use right now should be part of our life.
So here, people really should continue sticking to preventive measures.
As I've mentioned, that if we really stick to these habits, that even they are, yes, medical, but they are part of our religion. Also, we suffer a lot in Oman with what's called the Crimean Congo hemorrhagic fever, and it's usually comes during Eid festivals, basically because Muslims slaughter animals. It's usually from ticks or from the blood of the infected animals. And so we hope that people will take care of slaughtering, that they will do udhiyah in slaughterhouses. So this is very important to protect themselves.
People who will be returning from Hajj, what protective measures they should take?
People who have finished Hajj, inshallah, when they come back to Oman, many of them will have respiratory symptoms like acute respiratory symptoms like cough, fever, flu-like symptoms, illness. So they should avoid mixing with people, and also people should avoid going to visit people who came from Hajj with respiratory illnesses and respiratory symptoms to protect themselves and to protect the community so that they don't spread the disease.
Once again, Dr. Saif Al-Abri, thank you for all the advices.
My pleasure, and Eid Mubarak to you and all your viewers.
We trust public will continue to take necessary measures for all to be safe and healthy. Eid Mubarak to you all.